Welcome to this explainer. Look, if you place dental implants, you're already intimately familiar with the anxiety of the primary stability dip. You know, that highly vulnerable window where mechanical engagement drops off right before biological osseointegration actually takes over. Well, today, we're diving into a massive clinical breakthrough from the journal Materials that's designed to literally eliminate that notorious dip. To understand exactly how this works, we're going to unpack a pivotal 2020 randomized controlled clinical trial. It evaluates how a highly localized PEMF intervention fundamentally alters bone healing and the cytokine response. And guys, this matters because it completely shifts the paradigm. We're moving from just crossing our fingers and hoping a patient heals well to actively modulating their biological response from the inside out. The absolute crucial point we'll uncover today is how this precise intervention effectively bridges that dangerous gap between primary and secondary stability. It's all about shifting the delicate balance between bone resorption and bone formation, putting the odds directly in favor of the formation process right from day one.
Here's our quick agenda for today's explainer. First, what was studied. Second, what was found. Third, the clinical takeaway. And finally, your next steps.
Okay, part one. What was studied? The research question and methodology. Let's get into it. The core question driving this trial was super straightforward, but honestly profound. Can PEMF, pulsed electromagnetic fields, improve early healing and definitively stop that initial stability drop? I mean, we already know PEMF works wonders for healing stubborn fractures in orthopedics, right? But applying it locally, right inside the oral cavity, that's a total game changer. To test this out, the surgical team utilized an MED, which stands for Miniaturized Electromagnetic Device. The brilliant part? It looks and acts exactly like your standard healing abutment. Inside, though, it houses a microelectronic module that generates a localized PEMF to stimulate osteoblasts and modulate the surrounding biofilm. You literally just swap it in for your standard healing cap using the exact same routine protocols you already use. As for the methodology, it was incredibly rigorous. They looked at a total of 40 implants across 19 patients. The patients were randomly assigned to receive either the active MED or a completely non-active sham device. After replacing the standard abutments, researchers meticulously tracked implant stability using resonance frequency analysis, so ISQ, and tracked inflammatory markers in the crevicular fluid over a full 12-week period. Moving right along to part two. What was found? The clinical and microbiological data. When we look at the primary data from the study, specifically the mean differences over time, the contrast in early implant stability quotient, or ISQ, is just striking. By week 2, the control group is already dropping down into negative territory. But the MED group? It's actually climbing. It's moving in the complete opposite direction. Let's actually isolate that critical first 2-week primary stability window. Based on the study's intragroup analysis, the MED group increased in stability by 6.8%. Contrast that with a devastating 7.6% decrease in the control group. Think about that for a second. That 7.6% drop, that is the exact stability dip we all lose sleep over. But the PEMF treatment completely inverted that trajectory. And it gets better. Over the full duration of the trial, the MED-treated implants achieved a statistically significant overall stability increase of 13%. That's compared to an overall 2% decrease in the control group. So we aren't just talking about a marginal, nice-to-have improvement here. This is a fundamental structural shift in the entire integration timeline. Now, this macroscopic stability that we can physically feel in our hands, it's heavily supported by some incredible microscopic data. Microcomputed tomography from related preclinical models actually shows a massive 56% higher trabecular bone volume fraction. The osseointegration process is accelerated by more than 3 times. Plus, clinically, in the human trials, radiographic evaluations prove significantly lower marginal bone loss at both 6 and 12 weeks. Zooming in to the cellular level, the shift is just as dramatic. We all know that bone resorption is heavily driven by inflammation. Well, in the crevicular fluid, the MED group experienced exactly half the spike in the tissue-destructive cytokine TNF-alpha compared to the control. We're talking a 30% spike in the control versus just 15% with the MED. The PEMF is actively putting out that inflammatory fire. But what's truly groundbreaking here isn't even just the biomechanics, it's the microbiology. Really recent data published in the Nature journal NPJ Biofilms and Microbiomes evaluated this exact PEMF device right in the human oral cavity. And what did they find? A massive 5-fold or greater reduction in 23 distinct bacterial species around the implant. By specifically suppressing primary pathogens like P. gingivalis and T. forsythia, the exact culprits driving peri-implant tissue destruction, PEMF is stopping the bacteria that cause bone loss before they can even organize into a mature, destructive biofilm. Crucially, it modulates the microbiome dynamics toward a healthy profile, and it does it without using a single drop of local or systemic antibiotics. All right, part 3, the clinical takeaway, what this actually means for your daily practice. Ultimately, this completely changes the paradigm by bringing unmatched predictability in true preventative dental care into your operatory. Predictability is finally achieved because we are eliminating that primary stability dip, which safely opens the door for early or immediate loading. And it acts as true preventative dental care because it's actively stopping the inflammatory and bacterial precursors to peri-implantitis way before surgical intervention or antibiotics are ever even needed. And from a workflow perspective, it could not be easier. Because the MED is a ready-to-use, single-use healing abutment, it requires absolutely zero capital equipment purchases and zero changes to your existing surgical protocol. Seriously, you simply screw it in instead of your regular healing cap. It seamlessly mitigates your failure risks while maximizing chair time efficiency and keeping post-op complications to an absolute minimum.
Part 4. Next steps. How to transform your clinical outcomes.
You absolutely need to get your hands on this technology. Follow Magdent on Instagram and LinkedIn at Magdent MED and visit magdentmed.com to book a demo. Make sure to scan the QR code or follow the Instagram link to see real, actual clinical cases and watch the science in action. So ultimately, you have to ask yourself a question. Will you continue to let the inevitable stability dip dictate your loading protocols and just cross your fingers during those first few vulnerable weeks? Or will you take total, active control of your clinical outcomes with PEMF? The science is clear, but the choice is yours. Thanks so much for joining me on this explainer, and I will see you next time.